Greetings, my name is Jeffrey Guterman, and in this presentation I describe the theory and practice of Albert Ellis's Rational Emotive Behavior Therapy, REBT. Now I'm going to attempt to do so by identifying Ellis's positions across various key issues. First, I begin regarding the issue of human nature. Now, Ellis has claimed that REBT is a humanistic approach to psychotherapy, but not exactly of the type of Carl Rogers or Abraham Maslow, but humanistic in the sense that REBT views humans as they really are. Thinking, feeling, and behaving creatures. These three aspects of human functioning are interrelated and interact in that thought, feeling, and behavior never occur in disparate ways but are always occurring simultaneously. So if you think about something, then you consequently or correspondingly feel and act in relation to it. If you change one aspects of these aspects of human functioning, then consequently you'll change one of the other two aspects. So if you change the way you think about something, you will in most cases change the way you feel and act about it. Now the humans in their natures have biological, social, and psychological tendencies to act both self-helpingly and self-defeatingly. And this is where Ellis used the term rational and the term irrational to describe his approach. Rational meaning in your self-interest, and irrational meaning against your best interest, or against your self-interest. But because we are social beings, it is often considered in your best interest to consider the best interest of others also, and against your best interest to not do so. So human nature is to think, feel, and act both in your best interest, meaning toward your goals, both not only your short-term but your long-term goals, but also against your best interests and goals and values. Now, the theory of problem formation and psychopathology, a second issue to identify in terms of Ellis's position, is as simple as ABC, and Ellis has developed through the years and revised and expanded upon an ABC theory of theory problem formation or psychopathology. And the theory holds that A, activating events do not directly cause C, emotional and behavioral consequences, although our culture tends to think that events directly cause feelings. It's in our everyday language. You made me angry, it is depressing, you made me love you, and so forth. But in REBT, the theory holds that it is not so much A that is the primary determinant of C, emotional and behavioral consequences, but rather it is B, the beliefs about activating events, that are the main cause of emotional and behavioral consequences. And in particular, when you're feeling emotionally and behaviorally disturbed, it's C, not sad but depressed, not concerned but worried, not annoyed but angry, and therefore acting self-defeatingly, irrational, against your best interest, and not acting self-helpingly, meaning rational, for your best interest, then it is presumed, it is theorized that you're holding irrational beliefs at B, not rational beliefs. And irrational beliefs consist of preferences, wishes, hopes, desires, likes, and wants, where irrational beliefs consist of demands, commands, have-tos, needs, musts. And the central theory of REBT is that emotional disturbance is largely caused by musts, demandingness. And Ellis has said that if you largely stay with your desires and preferences about anything and do not stray into unrealistic demands, commands, and musts, then it's really very difficult to make yourself disturbed about anything. Now, the theory of change in REBT corresponds to its theory of problem formation and psychopathology, in that the objective is to identify and dispute irrational beliefs and replace them with rational beliefs, and thereby alleviate dysfunctional thoughts, feelings, and behaviors, self-defeating thoughts, feelings, and behaviors. Finally, the bread and butter technique, the main technique in REBT would be disputation, which is the disputation of core irrational beliefs, and this would be cognitive disputing of irrational beliefs. There are various methods of doing so, including the Socratic method of disputation, where the therapist or counselor helps through a series of questioning of the client, such as where is the evidence that you must, and so forth. Other techniques would be the use of coping self-statements, where the therapist or counselor helps the client repeat to themselves over and over various rational coping self-statements. These are cognitive techniques. In addition, REBT is extremely multimodal, integrative, and eclectic, and uses a variety of cognitive, emotive, and behavioral techniques, all designed to help the client identify and dispute irrational beliefs and internalize a new rational belief system, which they can in turn attach to both current and future activating events, and make themselves less disturbable both in the current and future. So basically, that's it in a nutshell, the theory and practice of rational emotive behavior therapy, REBT.